Join the UGraft revolution.
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 People that don't experience significant hair loss don't really realize how much it impacts almost every aspect of your daily life.
Well, I first started losing my hair, I was in college, so I went on Propecia and that was fine. But as I got older, it just sort of progressed to the point where I couldn't ignore it anymore.
When you look at yourself on a consistent basis, you see things that others do not see.
When I turned around 42 or 43, it started to get thinner. The sides of my hair were also getting thinner.
As soon as I graduated from high school, I started noticing differences in my hair, mostly in the form of recession.
And literally, my eyelashes were gone. I had bald spots on this side, bald spots on the front, and it looked really terrible.
In my case, it was probably when I was 35, 36 years old. Once it started, it was extremely rapid.
Hormone changes and aging and plucking made my eyebrows look like non-existent.
You either deal with it or you're crippled by it, or in my case, you go to a doctor to do something about it.
Hey, how are you? Good to see you.
All right.
How's the hair?
It's doing great.
It's doing really good. Thank you.
I didn't start off thinking I'd be a dermatologist. What got me involved in it is my own situation with hair loss. It happened when I was about 27, internal medicine resident in New York. I was receding, and naturally I saw an infomercial on hair transplantation. I went for it. Within a week, I had a hair transplant with a large strip scar to go with it. And that was what started my odyssey into dermatology and hair restoration. Being an African man with short curly hair, there was little information. I was told this scar will be very thin, and it all turned out not to be that way. Then I decided, well, if I don't like this, and this is supposed to be the standard of care, I might as well get involved and see if I can make a difference. And that's how I decided to become a dermatologist.
Dr. Yu is a board-certified surgeon and dermatologist. A well-published academic researcher in the field of hair restoration, Dr. Yu has been featured in a number of prominent media outlets. He is a pioneer in developing new advances in reversing hair loss. UGraft opens new doors for men and women of all ethnic backgrounds.
Traction alopecia, or what's known as not having any edges, is very prominent in the African American community. Even as a child, your hair is placed in these tight hairstyles via either cornrows or tight ponytails on a weekly basis. So it's very common. I normally like to wear my hair pulled off of my face, and just styling it was kind of a task itself. That's when I noticed that, okay, I need to do something.
To address Vanessa's traction alopecia, the Dr. Yu punch curl, invented by Dr. Yu, was the innovative tool needed for her afro-textured hair. In afro-textured hair, the linear scar-free method of hair transplant called FUE is often unsuccessful because of the severe curliness of the hair under the skin. The Dr. Yu punch curl, invented by Dr. Yu, is the only tool that has shown success in all cases.
I'm an actor. I've been acting pretty much my whole life. I've done shows like Shameless and NCIS and Rescue Me and stuff like that. Throughout one of the seasons that I was doing, I noticed that I was losing my hair. And as the season went on, I became progressively more bald.
Literally, my recession was from here, where my hairline is, all the way to back here. As my hair receded, as did my confidence. Being an 18-year-old guy, venturing into college, mentally I became a completely different person due to the devastation, and it was quite traumatic.
I actually went to go get false lashes done where they do my nails at. They used this really thick black glue to put them on so they could be on for like a couple of weeks. So I decided to go take them off by the third week because they were already falling off. I'm in the shower and I'm taking them off and my lashes start coming off. It made me feel so terrible. I didn't even want to go outside. I wanted to wear glasses all the time. It made me feel really insecure about myself because I feel like the eyes are kind of like the windows to your face, or it's just it's what people look at when they talk to you.
Michelle needed an eyelash restoration, but conventional eyelash transplants use head hair, which is too coarse and difficult to maintain in an upwardly curled natural eyelash form. Also, when head hair is used, the patient has to curl and perm the hairs in a professional salon to keep them curled, and the eyelash hair must be trimmed every 2 to 3 days. But due to Dr. Yu's unique ability to use body hair, with the aid of the Dr.UGraft Revolution technology, and the use of leg hair, specifically in Michelle's eyelash restoration, trimming is now done in intervals of 2 to 3 weeks instead. Her eyelashes look more natural because hairs from the body areas mimic natural eyelashes more closely. Dr. Yu is the first physician in the world to establish this approach, and Michelle's case is featured in the Plastic and Reconstructive Surgery Global Open Journal.
I'm 50 years old now, and probably about 10 or 15 years ago, I started to experience rapid hair loss. It did finally stop, but at a point where I felt that my life was impacted rather dramatically. That's everything from getting out of bed and looking in the mirror, which can be extremely discouraging, sort of puts a negative spin on your entire day, to going out to dinner with maybe friends or colleagues you haven't seen for some time, family reunions, homecoming, dates.
There was always hair loss solutions for men. When I did the research, I did not find too many that specialize in treatments or options for women. I hope I'm helping some other women out there that have issues with their eyebrows and maybe are too shy or too embarrassed to come forward and do something about it.
When it comes to eyebrow restoration, traditional hair transplants use only head hair as a donor source. However, compared with normal eyebrow hairs, head hairs grow faster, longer, and are coarser, resulting in harsher-looking outcomes that require high maintenance and frequent trimming. Dr. Yu overcomes these challenges in patients like Sarah by using his Dr.UGraft Revolution technology to select and transfer finer, more fitting hairs from the nape of the neck or body areas. The result has a more natural look and ultimately requires less frequent trimming and maintenance. 2 groundbreaking publications authored by Dr. Yu in Dermatologic Surgery and the Journal of the American Academy of Dermatology describe this approach.
What you've done for me.
You're very welcome.
Thank you.
And the idea is to have a procedure that restores hair without creating the linear scar, and hence the follicular unit extraction FUE method. My first challenge at that point is to create a process or a technology that will leave the minimum amount of wounding, which means seamless healing, and still produce viable grafts that will grow consistently. That means we are also able to go to other hairy areas beside the head to expand donor supply so we can satisfy the needs of even severely bald patients.
Dr. Yu's UGraft system is a revolutionary procedure that gently lifts hair follicles, resulting in more viable and healthy hair for transplants. The unique angle leads to quicker, less noticeable healing. The first hair transplant took place in the 1950s, but you wouldn't want to use old methods or tools any more than you would want to use the original cell phone.
The conventional tools usually will only do well with hair derived from the head areas. And we want to create a tool that can expand the donor supply, which means we can extract hair from the head as well as other hairy areas of the body. The U-punch rotor consists of a punch, a patented punch. It also results in very healthy follicles, which means a very consistent yield or growth of the grafts that you extract with them. Because of these unique features, we are also able to take hair from other parts of the body, including the chest, the beard areas, without creating untoward scarring. The next challenge is to create a device that can extract tightly curled hair as found in most Afro-textured hair, for instance. That remained the challenge in transplantation. And that's how the U-punch curl came to be. The tip of the punch is very unique, and this is the only tool that can reliably and consistently extract all types of tightly curled hairs, including the kinkiest or the most tightly curled Afro-textured hair. So in the UGraft system, it's all-in-one package, basically, and that's what the UGraft revolution is.
If it's your first surgery, it should be done right, and if you've tried before and had poor results, Dr. Yu can fix it.
My understanding of the UGraft technique that Dr. Umar uses in regards to African American hair, it's less damaging to the hair follicle. It will stay implanted and it will grow properly versus the other techniques where the hair follicle will just fall out or it won't stay in. So that would be like a waste of money.
He does FUE, which is follicular unit extraction. What that essentially means in layman's terms is there isn't any smiley scar in the back of your head. He also uses his own UGraft method, which I had looked at the results online, and it minimizes what is already minimal scarring from FUE. There's just essentially individual hairs, but the way they're extracted by Dr. Umar using his tool set is, I think, superior to others.
To create a natural look, Dr. Yu extracted fine hairs from the nape of Rod's neck, ultimately creating an undetectable hairline. Dr. Yu is the first physician to define this new standard of approach for the creation of softer, more natural-looking hairlines and temples. Dr. Yu's unique approach is highlighted in this landmark publication, featured in Aesthetic Surgery Journal.
This industry, basically, a lot of physicians are unethical. They make their profit off of people's insecurities, and I fell prey to that. I had a strip surgery. Strip surgery is where they make an incision in the back of your head, remove the hair, and do the transplantation. Complete disaster with a scar on the back of my head. It looked very unnatural. There's a term, they say pluggy, where it's just, the density is not good. It just doesn't look natural. Like, people know you did something. Instead of just taking hair from the back and the sides of your head, Dr. Umar can maximize beard hair and body hair.
Borisa had prior surgery using conventional approaches, which ultimately used only head donor areas. But because of his extensive baldness, conventional approaches were doomed, because Borisa simply didn't have enough remaining head hair to meet his hair restoration needs. Moreover, the strip surgery and FUE methods that were previously performed on him yielded bad results because of poor technique. Despite these prior surgery attempts, Borisa was still bald, had an odd patchy hair pattern, and also, sadly, suffered from depleted head donor hair for future corrective surgery, as well as the dreaded linear strip scars. Borisa was left in a state of hopelessness until he met Dr. Yu using his unique Dr.UGraft revolution technology that includes the Dr. Yu punch rotor for body hair transplantation. Dr. Yu unlocked the donor hair potentials of using beard and chest hair to successfully help Borisa.
He has to basically paint, like a painter, the follicles on my scalp. In order to do that, in order to make it look natural, it takes a tremendous amount of creativity, of artistry. And so when I heard that, and I heard the care and the passion that he showed for, making it look really good, like he takes pride in how it looks. And I was like, well, that's my guy.
Through many years, there was always hair loss solutions for men, but nobody considered that women may have the same situation or similar situation, and no one offered any kind of treatments. And when I found Dr. Umar and I noticed on his website that he does have treatment for women, that's one of the reasons why I picked him to go and talk to him.
Probably spoke to or consulted with 4 or 5 different hair transplant specialists after doing research on who I consider sort of like in the top 10. He clearly gets it. He's clearly done this a lot. He's clearly seen people of all ages with all types of hair.
Best decision of my life, by far.
We've been published in at least 10 scientific, medical, and peer-reviewed journals in the field of hair restoration.
Well, the procedure was actually really nice. I didn't feel anything because I was asleep. I just remember waking up and it was done.
My experience was amazing beyond expectation. The procedure was really short. Like you would go to a spa, or like you'd go have a facial, or like it was not anything uncomfortable.
He added like a full inch of hair on both sides of my hair, on my left and then on my right.
You let Dr. Umar do his magic. You wake up with eyebrows, and it's not painful and it's not inconvenient, and I actually drove myself home, no problem.
It's really, really a simple process, and it's just a cool customer. Makes you feel immediately comfortable and gives you a level of confidence, not only in his ability, but in the outcome.
It was really a pleasant experience. Lunch was provided for me every day in front of the ocean. I did not experience any pain whatsoever, and unlike other procedures, I didn't experience any swelling.
Hair restoration is not just about restoring hair, it's actually about restoring confidence. They're able to go out there and give their best, give their all, without thinking about their hair, how it looks. So that's the kind of moment that we work for.
Before my procedure with Dr. Umar, going out in the evenings, I was always so concerned that people were just staring at my hair all the time. And I was always wondering, did I do a great job camouflaging my hair this evening? Now, after the procedure, going out, I'm enjoying myself more because I'm not so worried about the appearance of my hair.
My life has improved in all areas because I feel like I've improved. I have confidence again. I'm happy. I don't really have depression anymore or anxiety.
People weren't sure exactly what had changed, but you get things from you look younger to you've lost weight.
I just feel more at ease when I'm out.
It's something natural. I don't even think about it. It became part of me.
Other people's responses to my treatment have been pretty much dumbfounded. Every single haircut I get, they can't believe it.
You have to remember that the eyebrows are the frame for your eyes, and your eyes are the windows to your soul. So you gotta have that frame right.
You know, every woman that goes out to get fake lashes from somebody should really look into this, because it's something that's gonna last you your whole life.
Your level of self-confidence is different. You can get off an airplane with the winds blowing and you don't feel like, oh my gosh, the 12 hairs I used to have there are flowing the wrong way, because you've got enough up there to sort of be natural. You can get out of a pool, just any sort of social setting. You know for a fact that nobody's staring above your eyeballs.
I've recommended Dr. Umar to countless barbers in Los Angeles.
You feel like you can get on with everything else you want to accomplish in your life because you don't have this sort of monkey on your back always nagging or sort of dragging you down every day.
Dr. Umar is a miracle worker. I mean, literally, miracle worker. He really restored, not my hair, but he restored my life.
Are you ready?
Come with me and join the UGraft revolution.
Join the UGraft revolution and choose advanced, effective innovation with Dr. U. Contact Dr. U and rethink the impossible with the UGraft revolution.